This video is on port access. Please prepare the following items for the procedure. The items needed are shown here. Before you begin, check the relevant interventional radiology report for the type of port being accessed. Explain the procedure to the patient, perform your hand hygiene, examine and palpate for the location of the port and catheter tract. Look out for any erythema, swelling or tenderness, which may indicate leakage or infection. Prime the non-coring needle, 3-way stopcock, and needleless connectors. Clean the port site with chlorhexidine solution. Notice the technique where we use a circular motion at least 3 times over the port site. Clean and drape as required. Now we are preparing to access the port proper. Stabilize the port between 2 fingers of the non-dominant hand. Insert the needle with the other hand with firm pressure at a 90-degree angle into the center of the port until it hits the base of the port chamber. Now confirm the position of the port by aspirating for blood return. Flush the port with 20 ml of normal saline and clamp, leaving 1 ml in the syringe. Follow this by flushing with 50 units of heparin saline and clamp, leaving 1 ml in the syringe. Secure the needle with a transparent dressing. Please take note, only use a non-coring needle to access the port. If the patient requires CT imaging, they will need a power injectable port and you will need to use a CT-compatible power non-coring needle. This video will explain how to deaccess a port. This is a picture of the items to be used. Explain the procedure to the patient and prepare the requisite items. Scrub the needleless connector with an alcohol swab for at least 10 times. Check the position of the port by aspirating for blood. If there is good blood return, flush port with 20 ml of normal saline and clamp, leaving 1 ml in the syringe. Follow this by 500 units of heparin sodium in 5 ml and clamp, leaving 1 ml in the syringe. This is for the purpose of terminal flushing. Gently remove the transparent dressing. Prepare a gauze. Stabilize the pot with your non-dominant hand. Please inform and let the patient know that you are about to remove the needle. Hold the needle band with your dominant hand and remove the non-coring needle by pulling it upward in one smooth motion. Apply gentle pressure to the excess site with a sterile gauze. Please make sure there is no bleeding. Apply a plaster to the former excess site.